this because he knew I was going to drop it. So steps were definitely a problem. Sitting was becoming painful, making traveling difficult. My husband likes to ride motorcycles. I could not ride with him. 30 minutes was about the limit. Couldn't stand on my feet for longer than an hour or so. I gained 60 pounds, 4+ clothing sizes. And moving in the mornings and loosening up was taking longer and longer. I could no longer keep up with my active family. I have 4 children, birth children, ages 15, 17, 19, 22, and we just adopted a 13-year-old son. And I couldn't keep up. They're very active. I was starting very much being a sideline parent. So our medication regimen included Enbrel. Anybody know what this is? You nurses know what it is. It's a biologic drug. It's also something they use to treat cancer. It's a clicker. You inject it. This drug dangerously lowered my immune system and my ability to fight infections, especially TB, fungal, and bacterial infections, the bacterial infections that take over your whole body. My maternal aunt lost her life to one of those such things from her medications, from her rheumatoid arthritis. I began this drug after taking Humira for about a year, and it quit working as effective, so we moved on to this. Now because, let's see, then there's this injectable methotrexate. You know what this is? It's also another drug that they use to fight cancer. It also lowers your immune system. My side effects from this included abdominal issues, mouth sores, shortness of breath, flu-like symptoms, bruising and bleeding issues, and blurred vision. And that's just what I experienced. There are more. This drug requires frequent blood testing to monitor the harmful effects on your liver and your kidneys, and occasionally, in the future, a liver biopsy would have been necessary. So to help counteract this medication, you take this medication, folic acid, 5 days a week, not the day before or the day of taking this medication. Okay? So then we're also taking doxycycline. And when I started taking this, I suddenly developed high blood pressure. But wait a minute, was this causing it? Or was it this medication, my anti-inflammatory medication, which also causes hypertension? Was it this? Who knows? But so this year I started on blood pressure medication, Mystolic. Meloxicam, anti-inflammatories. How many is on them? How long you been on them?
Good while.
More than 3 years?
A year.
5 years. I took it daily for 5 years, and clinical trials of using drugs like this for only up to 3 years of a duration time showed an increased risk of cardiovascular events, stroke, serious gastrointestinal hypertension, and kidney issues. 5 years. Clinical trials show up to 3. I've also been taking allergy shots for 10 years. This is also an immune kind of issue. 10 years. How long do most allergy patients take shots, nurses? About 3 to 5 is what my ENT told me. And he told me that I would be on them for the rest of my life because of this issue. Rest of my life, allergy shots. Now, y'all see all these needles up here? Needles. Had 4 children without epidurals. That's how bad I hate needles, and this is my life. This is what I'm doing. I think my husband used to enjoy giving these to me. I always had to be nice to him this day of shots. So then I just decided I could be mean and give myself my own shots. So, about 8 months ago, my rheumatologist, because we're having side effects from this, adverse side effects, that's not good, sends me home to research. Remember when I came home and told you? She wanted me to research IV chemotherapy treatment to treat my RA. That was the medical professional's answer to my symptoms. This business right here cost me $185 a month in copays. We've got good insurance. So my copay, but my insurance company was being billed just for this. This does not include every time I got an infection, sick, or had to go to a doctor for normal things, $39,500 a year. This is $750 a shot. I was doing it once a week. So 2.5 months ago, Dwight asked me if I had 30 minutes for him to tell me about something. He wanted to talk to me. I was scared of him. I mean, Scott and I, was I worried? I was worried. What had I done? He goes, well, have you made him mad? Thought it was something to do with his kids, maybe. I said, they're not old enough. I'm a juvenile probation officer.
Hopefully you'll never see that from him.
So I said, no, they're not old enough. They're just like little. But I met with him and I listened to what he told me about these tea bags in the water. And Anthony Atkins tried to talk to us over a year ago. Larry Matthews tried to talk to me. He told me last night, it was about 8 months ago. Didn't really listen. Dwight had no idea that I was on any of this medication, no idea of my diagnosis. But thank God, and I want to make that very clear tonight, that God has used this to give me a testimony that I'm sharing with you today. Okay, this is something God's created and God's done, and we want to give the credit where credit's due. But thank God that He opened my ears and opened my eyes, and that Dwight was faithful and following through and pursuing me to hear what he had to say to share. So 10 weeks ago, yesterday, 71 days today, I quit all of this, and I started getting healthy and repairing the damage done to my body by drinking the water with the X2O and using some of the other Xooma products. I've lost 22 pounds, 23 inches. My chronic fatigue is gone. I now have the energy to go to the grocery store, cook dinner, complete simple household chores when I get off work. Before, I was just simply struggling to get through the day just to get home to crash. Does that sound familiar? Just can't wait to get home, do nothing, just sit there, because that's pretty much what the life was come to. If I had a big event, like my daughter's wedding, or a photo shoot that I do on the sides, I would have to rest for days up, and then recover for days after an event where I was on my feet. My children don't have to open things, carry things, run to my car. What did you call the kids? That makes me so mad. What did you say?
Errand boys or something.
Yeah, he goes, get one of your little errand boys to go do it for you. Constantly, I was, so now I'm just like, well, I can do it myself, going up and down the stairs. And unfortunately, they're not always having to clean house for me anymore. I've decided I still don't like it. I think I need to make that another short-term goal that I can afford a housekeeper.
That's it.
That's right. My husband doesn't have to help me up and down the stairs or the bleachers anymore. He'd already trained himself to stop, wait on me, and wait for my hand placement on his shoulder so that he would walk in front of me step at a time for me to get down. I can immediately walk and get up when I get up in the mornings, and after sitting, I don't have to constantly shift when I'm sitting. And I started walking some and even took off jogging a couple of times. So I've gotten my life back. And what is that worth to me? 72 days ago, I was sitting at one of these tables, and I wrote down some short-term goals as I was listening to Varnell. And I think, Peggy, that might have been first time. I think you told us you lost 10 pounds that night. And I listen to Bobby Gray because I play sports. And I was hearing all these things they were doing. I made a list of short-term goals and long-term goals of what I wanted to happen. Well, my first one was I wanted off of this poison. And I wanted doctor approval to be off of this. Because society tells us, well, I can't stop that. The doctor's not told me it's okay. And I about gave Tommy Weber a heart attack when we called him and said, yeah, Dwight said, she stopped it all. Cold turkey. And I think Tommy about had a heart attack and says, well, do this. But I stopped it all, and I went to the rheumatologist this week. And she said, you were doing so well. Stay off of it. Don't come back in 3 months. Come back in 4 months. And if you're continuing to do so well, we will put you on an annual or PRN return back as needed basis. Woo!
Yeah.
So that wasn't enough for me. Because guess what proves? I mean, she looks and she feels and she, it's about how you feel. I knew I felt 100% better. I'm like, what's that blood work going to show? The blood work came back. All the rates are the same. One's even a point lower than it was when I was on the medication. Secondly, I wanted to get my products for free, thanks to a lucrative company. That's happened, and I just don't use the X2O and the Focus Up. However, my husband calls the Focus Up crack. He does.
But it's legal crack.
It's legal crack. Anti-Doping Association, actually, it's approved by the Anti-Doping Association. I have some of my children are athletes. My 15-year-old uses it when she plays ball and when she's in school. And her coach noticed the very first time she used it, by the way. But I use more products because my immune system was so compromised, and I'm trying to rebuild and repair the damage. And I'm still telling you, because of the lucrative company, the way they set up the compensation plan, I have not had to pay any money out of pocket for what I'm personally using. Third, I wanted to start being active again by doing the things I enjoy with my family, doing the things I enjoy, taking care of them, and just feeling healthier and looking healthier, and that's also happened. So in 10 weeks, I've met the short-term goals that I wrote out, sitting at the table just like y'all are today, and I'm looking forward to sharing with you about my long-term goals in the future.
Thank you, Penny. Give her a hand, folks. I always ask Penny this, just like I do most people, but first of all, I say, has it changed your life? And you always say, what?
I've got my life back. I've got a new aquarium to swim in.
This wasn't meant to be a lifestyle. There's 2 cancer drugs in this bag. You know what the side effects of those 2 cancer drugs are? May cause cancer.
Lymphoma.
Now think about that. There's companies out there telling you, you need to be on this product for whatever reason, but the side effects is it may cause cancer, and it's actually a cancer drug. Listen, I say this all the time. If Penny broke her arm a while ago, a doctor would be welcomed at that point. Probably some kind of a pain medication would be welcomed, wouldn't it? But if she was diagnosed as the next guy that I'm getting ready to bring up was as a diabetic, or you're diagnosed with heart disease or whatever, this is not meant to be a lifestyle. And I say this all the time. God created you, and He created you to survive and live off one thing. That's His things. This is man-made. You hear me say it every Thursday night. When God makes something, it's perfect, and every time man gets his hands on it, what does he do? Screws it up. This is not meant, your body was not meant to filter through this man-made junk. Is it necessary at times, short term? Absolutely. Doctors are great when we need them. But it's not meant to be a lifestyle, folks. We got to get more people off this kind of junk right here. So Penny, thank you so much.